Good morning, everyone. I'm Iryna. I'm lead product manager for an early stage startup, and I'm a founder of a product management consultancy based in Cheltenham. I'm so excited to be here today to share my ideas and an actionable strategy how we can approach cybersecurity risk management in health tech startups. In my role, I had an opportunity to bring an innovative AI-driven product to life. And today I'll walk you through my journey of how I put together a framework for cybersecurity risk management. So, what we will cover today. First is an overview of the technology, its risks and benefits. Then different types of risks in health tech, and basically the risk management framework itself. So here we have a bit of statistics. Health tech startups are on the cutting edge, bringing new innovative solutions that can track patient. So the solutions that bring diagnostics to the next level. And instead of checking health metrics at a clinic,
like phones in the middle.
Oh, thanks. So, can you hear me better? Yes.
Thank you.
Thanks. So instead of checking your health metrics in clinic, in person, now we can use mobile applications to track your health metrics. Especially using AI that can sift through lots of data and send the data directly to clinicians. So, with chronic disease on the rise, aging population in the UK, and fewer in-person visits, there is a growing need for real-time continuous health monitoring. And we can see it on the slide. Some analysts predict that the market for wearable devices will grow by 97% by 2033. Just out of curiosity, how many of you are using any health or wellness applications? How do you like them? Are you happy or not? More or less. I see. Yeah, basically you probably noticed that there is a boom in recent years in different mobile applications and wearable devices integrated with AI. So these applications can predict the outcomes, give you some recommendations, tips and tricks, non-medical advice. But integrating AI and wearables into health tech also introduce risks which can compromise patient data, disrupt clinical operations, and lead to financial loss as well, and undermine trust in digital health in general. And healthcare industry is increasingly targeted by cyber attacks because of critical nature of its services and high value data. So, as we are seeing rise in using AI in healthcare, both patients and doctors are starting to form opinions about it. So we can see that patients enjoy to monitor their health remotely, quickly. They feel more involved in their health management. They gain better understanding of their health. And doctors benefit from data-driven insight, streamlined operations, consultations, and early detection of issues. However, there are quite a lot of concerns. There are concerns about data accuracy, technology integration, over-dependence on technology, potential impact on the patient behavior, such as increased anxiety or inappropriate self-medication. But the biggest concern is related to AI, generative AI in particular, which includes machine learning models that can generate new data, insight, and give recommendations. So here is a closer look at how different AI use cases associated with different types of risks in health tech. So you can see that data privacy and security are very important. Also, transparency and accuracy of AI algorithms, and legal and ethical issues. So all these should guide the development of health tech products. In addition, over-reliance on AI could lead to reduced interaction with healthcare providers and even a decline in critical thinking skills among medical practitioners. So now we are going to have a closer look at one of the products. I would say it's a typical product for remote patient monitoring. So on this slide you can see system architecture and data flow. It's a very simplified version. So a typical health tech product for remote patient monitoring consists of a mobile application and a wearable device for a patient, and a web application for a doctor. So the medical device, the wearable device, it's usually equipped with a sensor that can transmit data to a mobile application, and AI model analyzes this data and keeps it in cloud. That allows us for real-time access and analysis. And the web application can be a kind of dashboard that shows reports to a clinician. So, based on the peculiarities of this system, we identified 3 different areas of risks. So first, yellow, risk related to user experience. Second, pink, risk related to hardware and software. And the third, purple, it's risk related to AI. Some people ask me why I see a risk related to AI as a different type of risk compared to software. The answer is pretty simple. With software, you can be sure 100% that it works. When you develop it, you have a hope that you have clear definition of done, and you can say that if you click this button, you expect this result. With AI, it doesn't work. You can't be 100% sure that the system is working, and basically what it means that it's working. So you basically can't test AI model exhaustively. So after considering the data flow in the system, we identified specific risks in each category. And it turned out that cybersecurity risk is present in every category, which makes it most critical to address. So it includes AI poisoning attacks, data security, data privacy, software bugs, social engineering, and poor user training. All this can lead to compromised patient data and the disruption of clinical operations. And basically, to spot the cybersecurity risks early and to create strategies to mitigate them, I put all these bits together into a framework. The framework consists of 5 steps. The first step is identifying the technology architecture based on use cases. So before build a new product, ask yourself what are the use cases, how the patient and the doctor are supposed to use the system. For example, in case of a chatbot, should it talk directly to a patient or to a doctor? Should it give medical advice or non-medical advice? What kind of data are you going to use to train your model? Is it publicly available data? Probably not, because you can't avoid bias and there is nothing commercial in using publicly available data. Here you should take into account how the data will be collected, how it will be transmitted, how it will be analyzed and stored, and also how it will be presented through user interfaces. So the second step, identifying risks associated with different areas of technology architecture. You can see also some approaches which you can use for these steps. At this point also, it's very important to keep all key stakeholders, to involve them in order to identify risks interdependencies. The third step, assessing and prioritizing risks. So here we should determine potential consequences of each risk, and also you can see approaches which can be used for this step. The first one, developing risk mitigation strategy, also depends on what kind of risks you assume are the most critical. And the fifth one, monitoring and reviewing. In addition to these steps, you should ensure that you are compliant with all the regulations, and you maintain continuous communication with key stakeholders, and you provide training and raise awareness among healthcare professionals. Also, it's important to keep the documentation up to date. I know that in startups, this piece is usually neglected because you don't have enough resources, you don't have enough time, and you're too excited to do some real things rather than update the documentation. But in case of health tech, that's really important to keep all the updates, all the results of risk assessment and best practices. In addition, I strongly believe that cybersecurity is about people, more about people rather than tech. So I think our top priority should be promoting security first mindset, both among team members and users and healthcare professionals. So that could include training, using real-world scenarios. Honestly, I hate tests, and as practice show that employees usually try to skip all these questions in order to finish it quickly and just get rid of it. So that's why real-world scenarios, simulations could work much better here. So to conclude, I think making cybersecurity a top priority when you develop digital health product is essential. Although technology and cyber threats are constantly changing, facing these challenges head-on allows us to innovate confidently and responsibly. So here is my contact information. If you'd like to continue the discussion, to ask some questions, I'm happy to connect with you on LinkedIn or just grab me after the talk. Thank you for your attention today.
Any questions? Do you have any questions for anybody?
Yeah.
Data anonymisation has been quite an important thing in health data, particularly for giving the data to researchers. do you think that artificial intelligence will mean that it's harder to anonymise data suitably to prevent someone from being re-identified from the various patterns in their health record?
Good question. It depends on how you train your model. In my project, we didn't use like ChatGPT, which is quite widely used today. It was like our in-house built model. So, I think it depends.
Okay. You happy? Yep. Right.
Yep.
Thank you very much.